EMS was called to the scene of a college campus where a 21-year-old male patient injured and lacerated his left ankle as he was walking down the stairs and fell into a metal railing. As I'm walking up to the scene, my first step is to determine scene safety. Is the scene safe? Based upon my general impressions, I see that the site is a college campus and administrators have made the area where the patient is located clear and open for EMS personnel, so I do determine that the scene is safe at this time. Now I question whether I need additional resources. Based upon the patient and my general impression, I believe that I do not need additional resources at this time. I am working with a partner and the two of us should be able to handle the situation. Before I proceed to assess the patient, I determined that I do need to wear appropriate personal protective equipment, which include gloves and safety goggles because there is blood involved due to the laceration. As noted earlier, there is only one patient involved in this scene, and it is a 21-year-old male patient. Based upon my general impressions, I see that this is a mechanism of injury patient in that he injured his left ankle, so this is a trauma patient, not a medical patient, based upon my general impressions. As I'm arriving to the scene, I see the patient appears to be stable, alert, and oriented. The patient is sitting up and able to communicate with me, so therefore he's also responsive. The only immediate life threat at this time that I need to handle is the patient's bleeding laceration. The bleeding is quite profuse, so my first step is going to be to apply pressure to that area, potentially use a tourniquet if the bleeding does not stop, so that the patient's immediate life threats are taken care of and managed. Based on the patient's responsiveness and the fact that he is seated and talking with me, I determined that spinal motion restriction is not required at this time. And that ends my patient assessment scene size up.